Dear students, this video will be useful for you to learn something about the daily fetal movement counts. Okay, that is DFMC. Myself, Ruth Kezia, Assistant Professor in Tribulum College of Nursing. Objectives: we're going to learn about the introduction, definition, advantages, disadvantages, instruction to the mother, procedure, recording, and results, interpretation, and warning signs of daily fetal movement counts. Introduction. Dfmc is a simple, non-invasive method for pregnant women to monitor their baby's movements. The obvious and the ideal person to count the fetal movement is the mother. Okay, so of course the mother is the only person, okay, and she can always count the fetal movements by herself at any time. Definition: DFMC or daily fetal movement count is a method used to monitor fetal well-being during pregnancy by tracking the number of fetal movements a pregnant woman feels in a specific time frame, which can indicate potential fetal compromise if movement decrease or cease. So within a time frame, how many is the fetal movement? That is basically the definition here. Okay, or say within 1 hour, within 2 hour, how many fetal movements the mother can feel. She has to lie down and she has to sit in one place and record it. Okay, and the results are interpreted and the actions are taken. Okay. Advantages: it is inexpensive. Dfmc is, there are various other methods to monitor the fetal movements, okay, by the non-invasive and invasive methods, but here this is the fetal movement counts done by the mother. Dfmc is the inexpensive method, and it is non-invasive, and it is convenient for the client. It serves as an indirect measure for central nervous system integrity and function. Disadvantages: many factors affect the interpretation of the fetal movement count. Okay, first thing is maternal sensitivity to the fetal movements may vary. Women may not feel the fetal movements. Fetal resting state decreases the movement. Sometimes if the fetus is sleeping, okay, it may decrease the fetal movements, and fetal movements can be affected by sound, touch, and external stimulation, and time of the day may affect the fetal movements, that is less in the morning and greater in the evening. So if you are counting the fetal movements in the morning, the fetus, if supposed to be sleeping mostly, okay, the fetus will be sleeping in the morning, so in that time the movement may be left less. So that is one disadvantage, the time of the day. And maternal use of drug, okay, if the mother is using any kind of sedation for some purpose, okay, then it is going to affect the fetal activity. So these are some of the disadvantages where we cannot rely on this method. And patient instruction: what are the general instruction for the fetal movement counting? Before, if you are educating a mother about fetal movement counting, what are the general instructions you will give to the mother? That is, count the movements at least once daily. Evening hours are good time because the fetus is most active. Wait until the fetus is active, then begin counting. Count 10 movement and then stop. Record the time taken to count 10 movements on the fetal movement chart. If the fetal movements are not felt, if the 10 movements are not felt within 2 hours, contact the clinic immediately. Okay, these are the basic instructions. What are the other instructions you will give? Fetal activity often increases after meals or light massaging of the abdomen. A short walk may make the fetus more active. A fetus normally has a period of sleep throughout the day, usually lasting for 20 minutes. During the last 2 to 3 weeks before delivery, activity normally decreases as the fetus presenting part is engaged and less room to move around. A movement may be quick, kick, swish, or roll. Do not count the hiccups or small flutters. Okay, these are the other general patient instructions you will give the mother. So this is the actual procedure. Well, there are two methods. Method 1, where the woman lies on her side, places her hand on the largest part of the abdomen and concentrate on the fetal movements. Okay, so the woman lying on her side, place your hand on the largest part of the abdomen and start counting. She uses a clock and record the number of movements felt. 10 movements in a period of up to 2 hours is reassuring. Okay, it means within 2 hours, if she is able to count 10 movements, then it is nothing to worry. She just have to keep counting daily until the delivery. Okay, after 10 movements have been perceived, she can discontinue the count for that day. So that is method 1. Method 2, where we will count 3 times a day. That is 1 hour in the morning, 1 hour in the afternoon, and 1 hour in the night. Okay. So these are the two methods. Now we'll see the interpretation, how to do the reporting. Notify the clinic if she does not experience at least 10 movements in a 2-hour period. So if you see in the picture, it shows a DFMC chart. It shows a different patterns. The first picture shows less than 10 movements in 1 hour. Okay, can you see in they have written as marked in lines. The first column is in the morning, the second column is in the afternoon, the third column is in the night. Okay, the first picture shows less than 10 movements, all the 3 period. Okay, morning, afternoon, and night. The second picture shows the movement is between 11 to 20 in all 3 times of the day. And the third picture shows more than 20 movements in all the 3 times of the day. Okay, so these are the different patterns of fetal movements that the woman can report to the clinic. So what are the warning signs? Less than 10 movements in 12 hours, okay, then it is a warning sign, and longer time to reach 10 fetal movements than on the previous days. So that also the woman should be able to compare. Okay, yesterday how was the fetal movements and today how it is. Okay, if something is different, if something is slower, then she has to report it immediately. Movements are becoming weaker and less vigorous, she has to report. Movement alarming sickness, that is less than 3 fetal movements in 12 hours, that is movement alarm signal. Okay, so she has to immediately report. Warning sign should be reported to the healthcare provider immediately and often requires further testing like non-stress test, okay, and biophysical profile. Non-stress test, as you all know, it is a cardiotocography machine is connected to the woman's abdomen, where two transducers are placed on the abdomen. Okay, one on the fundus and one on the umbilicus. The fundus will monitor the uterine contractions, and the transducer on the umbilicus will monitor that is the fetal movements. Both are represented as a graph in a sheet, and these both are compared against each other. Okay, then the reassuring will give you, we have to see whether it is reassuring graph or non-reassuring graph. And next is the biophysical profile, where we will monitor the fetal movements, the fetal heart rate, the fetal breathing, the fetal tone, and the amniotic fluid volume. All these five criterias are monitored, and the score is given. Okay, so based on that score, BPP, they will decide the treatment. So this is the flow chart. Okay, all pregnant women with or without risk factors, they have to monitor daily fetal movement. So you will give this health education to all the women, irrespective of whether they have any associated conditions or not. Okay, you will teach about this health education. So normal will be 10 or more fetal movements in 2 hours, and if it is like that, then she just have to continue the DFMC daily until delivery. If it is less than 6 movements in 2 hours, the patient must be advised to contact a doctor. Then she has to go for NST, that is non-stress test. As I told you, NST with no risk factors, continue with the DFMC. Normal NST with the risk factors. NST is normal. Okay, and but there is risk factors for the woman, like associated any other conditions, obstetric complications, or medical complications, any other complications, then you have to follow up with biophysical profile and amniotic fluid volume within 24 hours. And abnormal NST, then she has to definitely go for urgent CST, that is contraction stress test, and other procedures. If abnormalities persist, future management and need for delivery should be individualized based on the overall clinical picture. Okay, so I hope you gain some knowledge on DFMC, that is daily fetal movements. What is daily fetal movements? The definition. Okay, what are the general patient instructions you will give to the mother? What are the two methods you will do the daily fetal movement counts. That is, one method is by just making the woman to lie on her side and count 10 movements. If this 10 movements comes within 2 hours, then it is fine. The method 2 is counting 1 hour in the morning, 1 hour in the afternoon, and 1 hour in the night. And what are the warning signs and what are the flow charts we must go for the treatment regarding based on the interpretation of the results. Okay, thank you all.